For my wellness program, an industry analysis for my project is very different than most traditional business plans. The wellness services that I'm proposing for my organization are contained within a closed system in which competition is mostly against ourselves in terms of containing costs through effective management and innovation of services offered. In terms of industry maturity, wellness programs are definitely on the rise. The financial challenges of providing health benefits for employees is not unique to Memorial Hospital. Companies throughout the U.S. are looking for ways to cut the cost curve on healthcare expense. Wellness programs are being viewed as a primary opportunity to reduce these costs while providing valued benefits for employees. While wellness programs have been around for decades in the majority of U.S. companies, the idea of a quote-unquote robust wellness plan is somewhat new with rapid expansion. The old wellness plans were minimal in scope. Robust plans focus on preventative care to improve the health of entire populations. In terms of sensitivity to economic cycles, there is a very poor trend in healthcare. Costs far outpace inflation, while reimbursements are dwindling. This economic impact is challenging for any healthcare entity. Profit margins are shrinking, while the costs for healthcare coverage are increasing. For seasonality, wellness services will definitely see an impact. Winter months mean much higher volumes for acute care. My wellness plan will need to adjust for these seasonal volumes with a focus on acute care and vaccinations during the winter months, with a shift to preventative care during the summer months. One of the key technological challenges for healthcare in general is the use of electronic medical records, or EMR. Our hospital system has invested tens of millions for EMR development over the past several years. These investments will benefit my wellness plan by enhancing continuity of care amongst our providers and providers in the community. This continuity of care is a key component to preventative care strategies. In terms of regulation and certifications, I'm not sure if you could find an industry more regulated than healthcare. Abiding by these regulations and maintaining certifications are part of our organization's core competencies. Wellness services will not add to these requirements, but will need to adhere to most standards for general healthcare services provided by the hospital. In terms of supply and distribution, these concerns are minimal for my wellness plan. All supplies will be within our normal distribution channels with minimal increase in overall volumes. Distribution is mainly for the services offered. The financial characteristics of my business plan are also unique and non-traditional. Instead of a focus on revenues, my plan is a cost containment strategy. There are some considerations regarding what amount, if any, the customers will need to pay for their services. ROI for wellness plans are all about the customer, the employee, participating in the wellness services. There is a strong possibility that we won't charge anything. In fact, we will likely provide incentives for customers to access these services. The quote-unquote profit is measured in long-term reductions for overall healthcare spend. For industry changes, I expect that there will be rapid change and advancements to wellness strategies as more and more employees embrace the solution. We will need to keep a close eye on what these industry trends are, along with study results, to assure that we are maximizing our investments for the most effective results.